Beach FM, locals talking to locals.
Mayor of the Kapiti Coast, K.Gurunathan. Guru, good morning and welcome to you, sir.
Good morning, John, and good morning to the listeners.
Are you being suitably isolated? You're in splendid isolation, I trust.
Splendid isolation. Well, there's a lot of teleconferencing going on. And,
oh, yes.
Online stuff going on, and it's a different world in terms of trying to interface on council business and community business through this. Through the bubble of isolation.
Yes, that's really caught on, this bubble idea, hasn't it? I think
I think the Prime Minister was very smart when she used that.
Yes.
Amongst other smart things she's been doing.
Oh, very, very smart. Yes, I'm full of admiration for her. Let's just talk about what is happening locally, because we've got lots of people out there who are volunteering, they're putting forward their services. It could be in a very informal sense, could be in a slightly more formal sense, and of course we've got Sophie Hamford's group, and I imagine that there must be some level of concern for the health of the volunteers involved in this.
Yeah, I think one of the things we've got to know, and the Prime Minister and the Director of Health have already mentioned this repeatedly, that they are expecting numbers to spike into the thousands.
Yes.
Now, when that sort of thing starts to happen, centralized, organized delivery of many of his services, from psychological assurances to the actual physical services, will need some local support and local resources, and therefore that's an area that needs to be beefed up. And from what I know, some serious work has been undertaken to ensure that the welfare teams are working. We need some protocols on the ground in terms of the hygiene of the people who are interfacing with vulnerable people, and the isolation needs, isolation protocols also. Because one of the things about New Zealand is a large number of volunteers are usually the elderly. So this particular, we need to protect them. I mean, the elderly cannot be doing this particular type of work. So we need the younger people. But then there is an element of invincibility, I think,
that's right,
amongst young people, particularly since the main victims of the coronavirus in terms of death or afflictions have been the older generation. So we need some protocols, and I think the government is working very hard. The agencies are working very hard to ensure we have this hygiene and isolation protocols. And we don't know enough about how this virus works to give us complete safety in terms of the protocols itself. So we've got to be very careful.
Very.
I've talked to Brendan Duffy, the chair of the Mid-Central District Health Board, and we had a teleconference with the mayors of the northern region, because Kapiti has got one chunk of us looking north, that is, in terms of health services, that is north of Peka Otaki. So he's taking the message up also on this area, and I know our James Jefferson, who's the local controller here in the Kapiti Coast, he's taken the message also through our civil defense people, that we need to get this locked down before the actual spiking up.
Indeed.
So
I bet James has been busy recently, and I imagine many of your people at the council have been busy recently.
Well, it's been a massive repurposing to focus on this particular area. We've got the business as usual things, which are very, very critical in times like this, that when you turn the tap on, the water flows, you flush the toilet, it flushes, and your rubbish is collected. We've got to do all that. And then we have to refocus. We certainly have one of the most powerful person in the district is now James Jefferson, the manager of People and Places, who's now the local controller. Now, under this national emergency, the control command system goes from the national emergency services to the regional emergency. We have got a group controller there, and James Jefferson works under him directly. So therefore, there's a shift in the command structure in the power. So people need to understand that, because of the seriousness of the situation and the different powers that are effective. They know that the elected members are no longer essential services. I mean, that should tell you something.
Indeed.
Some people might say, long may that rain.
You mentioned the social team before. Were you referring to the KCDC social team?
Oh, yeah, we've got a welfare team down here.
The welfare team,
and the
yes.
regional area, the National Coordinating Crisis, they also have a welfare team. And a lot of the work will be coming down to the welfare team because the welfare team has got a template of interface with the whole range of community groups over decades.
Indeed.
So there is
very good network.
Yeah, so we have them. It's just getting the resources and the directions to continue to work with them. Because we don't. This is a new area, you know. We've got no idea how this is going to pan out, and therefore. But I'm glad also that finally the government is putting in place. There is a plan, and there's no need to panic because we know that the people have been asking, you know, where do I go for testing and assessment?
Yes.
Whether I've got I'm infected or not. Now the process is this: you ring up the health line. They will then vet you, and then if they think that you need testing, they will send you to what are known as swabbing centers. There's one in Paraparaumu, and there's one up here in Otaki. The other areas, the GPs will also do the same thing. But the point of this, and people need to understand this testing access is designed to manage high-risk areas. If you know that the patient having this flu-like symptoms has also had association with travel overseas,
yes,
or has had contacts with people who have been tested as positive, these people are given priority to go to the swabbing centers. What the government is now doing is that they know, and I've said it before, they have said that the numbers will spike into several thousand. So what's the next regime of testing that needs to be? So what they've now done is they've introduced this thing called community-based assessment centers, which they are rolling out across the country. And district health boards should have the strategic plans to enable one to come up.
Right.
Within 24 hours, they should be able to organize this. And I think up in Whanganui, they already have them. They've already been advertised, publicly advertised where they are. So what they deal with large-scale testing, where people could go to these places directly. So this is ramping up.
Indeed.
So it's good to know that there are plans in place.
Excellent. Could I come back locally, Guru, and playgrounds, of course, all the public areas that the KCDC services are closed, and particularly a concern about playgrounds, play equipment, etc., which cannot be cleaned during this process, and we know that the bug can live for several days on hard surfaces. So I can see exactly why the reserves, the playgrounds, have been shut down. But there's some concern being expressed that there's no notices up to that effect. Do you think there should be?
Well, put it this way, notices, if we had put the notices up quite early, I suppose it may have had some effect, although I doubt it will, because people who break these kinds of rules and regulations, who are not aware of the seriousness of the situation, will be the same people who will be breaking this. So there's nothing we can do about fools.
True.
And I'll be very strong about the language that I use. Because, look, at the moment, we have council staff who have already been repurposed for the whole range of things. We don't want to be endangering our own staff in the front line. The staff are also continuing to do the type of work that we need to do. Like, you know that the wet season is coming up. They are out there cleaning stormwater outlets and all those sort of stuff to ensure that we are not caught up in a flood in the midst of this sort of situations. And we need to look after them themselves. So the public need to be on. The TV advertisements has shown repeatedly said one of the areas they concentrate on is don't go to the playgrounds and stuff, the play equipment and stuff. So what else can we do to get these people on board with this message?
Put up some notices.
You know, I feel really frustrated in this area. Council can only do so much, but the message needs to be picked up by the public themselves. But having said that, if we have alerted the police now, and the police, when they do the patrols, they've been asked to look into these playground areas to ensure that people are not doing this or abusing or breaching these requirements. But at the same time, I appeal to people when you come across this situation, don't do it angrily. Don't do it in an aggressive manner. Be very calm and collected. And the Prime Minister said, be kind.
Yes.
We need to just have a very good conversation with these people and say, look, this is endangering your own family, your own children. And not only that, through your misconceived way of carrying your activities out, you'll be endangering the members of the public.
One final thing, Guri, you mentioned before video conferencing, and many people know that you're a citizen of Otaki, and thank God we've got the broadband around the country. It really has come into its own now, doesn't it? But there was some concern at some stage that Otaki would be left out of that. Have you found the broadband performance up to your requirements in terms of the increased requirements recently?
Yeah, yes it is.
So it's all good.
I haven't checked with Chorus to see whether they fully service it. I remember some months back they were still doing some work. I haven't checked with them yet. But I think from my own experience, I think it is, and I haven't heard people in Otaki complaining about this.
Excellent. Good news. Thank you for joining us. We look forward to doing it again. You're welcome any time here on Beach FM.
Well, feel free to call me up any time of the week, not necessarily set on schedules Mondays. If you think something's important, give me a call.
Thank you very much, Guru. Lovely to talk to you. Thank you for your company.
Thank you. Thank you to the listeners.
106.3 Beach FM.